This is probably a topic many of you are already familiar with. Hemoglobin A1C, that is glycated hemoglobin. Why do we use hemoglobin A1C? Especially in the diagnosis and monitoring of diabetes, what are our expectations from hemoglobin A1C, which we frequently use as the so-called 3-month average blood sugar? At what value do we consider hemoglobin A1C to be within the normal range? Is the hemoglobin A1C value that most people consider normal, where they say, if it's not above 6.5, don't worry about it, really normal for us? In this video, I will answer many questions about hemoglobin A1C. Hemoglobin A1C is the form of hemoglobin that has bonded with sugar. Actually, its unit is millimoles per mole. In other words, it tells us the amount of hemoglobin that has bonded with sugar among all the hemoglobins. We now express this unit, which is millimoles per mole, as a percentage among ourselves. 5.5%, 6%, or 6.5% and above. The hemoglobin A1C value gives the average blood sugar level over the past 3 months. Especially if the hemoglobin A1C value is 6.5 or above, we talk about a diagnosis of diabetes. In the past, before this value existed, the test we used more often was the oral glucose tolerance test. As many of you know, this is the sugar loading test, or OGTT. Among the patients considered candidates for the OGTT test, there were especially those with impaired fasting blood sugar or impaired postprandial blood sugar, those with fasting blood sugar between 100 and 126, and those with postprandial blood sugar between 126 and 200. Could this patient have diabetes? This would be investigated and an oral glucose tolerance test would be performed. This test is still frequently used, but the test we generally use as the gold standard is the hemoglobin A1C test. In the endocrinology and diabetes community, patients with a 3-month average blood sugar of 6.5 or above are now considered diabetic. Diabetes mellitus, in other words, diabetes. By looking at the hemoglobin A1C value, we cannot determine whether your diabetes is type 1 or type 2. This only gives us the average blood sugar level over the past 3 months. If your 3-month average blood sugar is above 6.5, you could have either type 1 diabetes or type 2 diabetes. Type 1 diabetes is usually diagnosed in children and adolescents, and its course is generally different from type 2 diabetes. Type 2 diabetes, on the other hand, usually develops as a result of insulin resistance. It is called non-insulin dependent diabetes mellitus. In type 1, there is no insulin in the pancreas. In type 2, however, insulin is present, but because there is significant resistance to insulin in the body, this insulin becomes ineffective. But ultimately, the result is the same in both cases. Our average blood sugar rises and our 3-month blood sugar level increases as well. If a patient comes to us and the blood sugar value we measure is high, we may suspect diabetes in this person. But if the person's blood sugar value is between 140 and 200, we need this test to determine whether or not the person has diabetes. In this test, there are 4 threshold values that are important for us. One is 4.8, another is 5.4, another is 6.0, and the last one is 6.5. A normal person's 3-month average blood sugar value should be between 4.8 and 5.4. If it is between 5.4 and 6.0, we say that this person's 3-month average blood sugar has increased. If it is between 6 and 6.5, we say that this person has prediabetes, that is, hidden diabetes. If it is above 6.5, this person clearly has diabetes. Sometimes I encounter the following situation with patients. They come in. Their 3-month average blood sugar is 7.1. They say, "Doctor, I have the onset of diabetes." They say, "In fact, this is not the onset, it is clearly diabetes." If your 3-month average blood sugar is above 6.5, it clearly means you have become diabetic. If your blood sugar average is 6.5 or above, you should urgently make a prevention plan and fight against diabetes. When it comes to lifestyle changes in diabetes, you will be welcomed by a very experienced team at our clinic. In particular, specialists in endocrinology, internal medicine, and cardiology will evaluate you in detail. A diet protocol will be created, and as you follow this diet protocol, you may even gradually reach a point where you can stop taking medications. I am saying this especially for type 2 diabetes. In our clinic, there is never a protocol of just prescribing medication and sending the patient away. We are not against using medication, but our patients can seriously overcome diabetes through lifestyle changes. If your 3-month average blood sugar is 6.5 or above, you can use medication. We are not against medications, but you can also manage diabetes seriously with lifestyle changes. Using medications is not an obstacle to making lifestyle changes. You can use medication, but with lifestyle changes and a good nutrition protocol, you may even reach a point where you can gradually stop taking the medications. The American Endocrine Society and the European Endocrine Society both recommend lifestyle changes as the first-line treatment, especially for diabetes. We also invite you to change your lifestyle and to lower your hemoglobin A1C values step by step. Here we witness patients recovering every day. You too can be one of the patients who recover. Don't forget to subscribe to our channel and watch our other videos about diabetes, hypertension, and chronic diseases. Goodbye!